Good morning, everyone, or afternoon, depending on where you are. Um, Welcome to our Echo series on Resurgence of New World Screwworm in the Americas. I'm Paula Stigler-Granados. I am going to be facilitating our session today, and I know we have a lot of people joining us. And so as everybody sort of joins, wanted to first go ahead and let everybody know that we do have Spanish translation for those who would like it through the auto captions feature. And I am going to let my colleague Maria introduce that, how to turn that on real quick.
Hi, good morning, everyone. So just following up to what Dr. Stigler Canales just mentioned, if you do need the interpretation services for today's webinar, please select the Show Caption button at the bottom of your screen. Then you'll go ahead and turn on translation, and then you'll select your desired language for today. Hola a todos, si necesitan el servicio de interpretación para la sesión del día de hoy, por favor seleccione el botón de subtítulos en su pantalla, active la traducción y luego seleccione el idioma deseado para la sesión del día de hoy. Gracias.
Thank you, Maria. And hopefully, if you wouldn't mind putting that in the chat as well, and for those that are coming a little bit later. So for that, we're gonna keep the language in English, so that the auto captions will be working in Spanish. However, if you have a question, um, you can feel free to put it in the Q&A in Spanish, and we will translate it for you, and also in the chat as well. So just to kind of explain a little bit how today's session will work, because we have so many people, we're going to do a Q&A, which if you can see at the bottom, there's a button for Q&A, and that's where you'll put questions. I know we have somebody saying good morning, and we appreciate you saying good morning. We're happy to have you here. That's where you're going to put questions for the presenter is in the Q&A, and we also have Sue Montgomery and Mark Fox from the CDC with us as panelists who are also experts on this topic and will helping us to be able to facilitate some of those questions in real time as they're coming in. Others, we will also have a chance for Dr. Chansey to be able to review them and answer them as they come up as well. So the chat feature we're going to use for activities. And then also we would love to hear who you are and where you're from. And if you are a community health worker or a physician or what your role is, if you want to put that in the chat, we'd love to hear from you. And then again, the Q&A we're going to reserve for questions about the topic. And the chat we're going to reserve for talking about activities and also introducing yourselves. And I'll kind of come back and repeat this in a minute, but just wanted to get us started with that. So next slide, please. So this is accredited today. Thank you to our South Coast Area Health Education Centers, AHEC, for doing this for us. If you are a community health worker, this will be CEs for you. And then if you happen to be a physician and attending, I just learned today that you can still get credit for this, but it's I just forgot what it was, level 2. Great. Can you, Rebecca, can you remind me what it's called again?
Yes, category 2.
Thank you. Category 2 credits for this, so that you would be reporting that yourself. We won't be sending you a certificate for that, but you are able to claim that. And next slide. All right, so we did have a session last week that was sort of a rapid fire on New World Screwworm, mostly aimed at healthcare providers and physicians. This session is sessions 2 and 3, will be a repeat of what we did last week, but we're breaking it down into 2 separate sessions, going a little bit slower over the information, and having a few more activities, because we are focusing on community health workers and in the community sort of communication about the disease. So this is our welcome right now, doing some introductions and announcements. Then we're gonna have Dr. Rebecca Chansey from the CDC give a discussion and a talk about this. And then we are gonna pause a few times for questions and answers. But also, again, we're going to use the chat feature to try to answer those in real time, and then we'll stop, do a few, and then we'll keep going. Next slide. So with that, I'm very excited to introduce our presenter today. Dr. Chansey is a medical officer at CDC, where she focuses on parasitic diseases and emerging zoonotic threats. She's also the co-author of the pediatric review article Congenital Chagas Disease. So also, by the way, if you've ever gone to our echoes on Chagas disease, we're happy to have you here talking about our new hot topic for this month. She's also had over 45 journal articles and book chapters on numerous parasitic diseases published. She's a pediatrician and has a strong interest in clinical management and public health epidemiology of parasitic infections, especially in children. She's been an invited speaker at lots of national and international conferences and is very passionate about educating others on parasitic diseases. She's currently recognized for her work in raising awareness of this resurgence of New World screwworm and its risks to human and animal health. Next slide. For those of you who don't know me, if you've been to our Chagas Echo sessions, you probably do know me, and I've met many of you in person as well, but I'm Dr. Stigler Granados. I'm an associate professor at San Diego State, formerly at UT Health San Antonio and Texas State University. I'm currently leading our environmental health division here, though, in San Diego. I have about a decade of expertise in Chagas disease, supported by a long-standing CDC cooperative agreement that we focused on education and community engagement around Chagas disease. I've worked with the Department of Defense and military populations, and this will be my 8th year, I think, leading echo sessions on Chagas disease. So again, this is a little bit of a different topic for me, but I'm learning a lot about this, and I'm really happy to be here to help co-facilitate this talk. My research usually emphasizes social determinants of health, also environmental issues in health along our US-Mexico border, making this very, very relevant right now. All right, next slide. So again, we are having continuing education credits available. There will be an evaluation at the end. We would really appreciate you filling this out to get the credits or even just to tell us some feedback about our program. And so with that, I think we are ready to turn it over. I'm just going to say one more time, just a couple of quick instructions. If you could please in the chat put who you are. I also see Maria, you're asking for interpretation services. Maybe Maria Gutierrez, if you could pop back on real quick and just give those instructions in Spanish one more time before we get started.
Hi, yes, of course. Hola a todos. Si necesitan los servicios de interpretación para la sesión del día de hoy, por favor seleccione el botón de subtítulos en su pantalla, active la traducción y luego seleccione el idioma que necesite para escuchar la sesión del día de hoy. Gracias.
Thank you, Maria. And if anybody has questions or needs that information again, feel free to put that in the chat and we will take a look at that. Again, we're going to use the Q&A. I think, like I see Dr. Wozniak, you put in the Q&A your info. If you could put that in the chat instead, if you don't mind. And we're going to use the Q&A just for questions about the topic, and we'll use the chat for all the activities and introducing yourselves. So we'll keep an eye on that for you all, and with that, I'm ready to turn it over to you, Dr. Chansey. Thank you so much.
Yes, thanks, Paula. And I see some people in the chat mentioning that they are healthcare providers. So if they wanted to review the session from last week, where could they find that as I share my slides and get ready?
I think we can put that a link in the chat. My colleagues at UT Health, we have a YouTube channel and a website where we have all of our Chagas Echo sessions, and that's where we're going to be posting. I don't know if we have it posted yet or not, but we will put the link in the chat where we will have that posted, and you can review the recordings of that as well. And again, this information is going to cover the same information that was covered in the first session. We're just breaking it down into 2 separate sessions. So this will be the first half of last week's session, basically. And then it's delivered a little bit differently, but the content is still the same. Context is still there.
Okay, perfect. And can you see my slides?
Yes, they look great.
Okay, I see one hand raised. Do we want to look at that before I go, or should I go ahead and start?
Oh, so we're not going to use the raise hand feature right now, by the way. I'm sorry, we're not able to unmute and mute you all because there's so many people. We have like 255 people right now. So if you do have a question, instead of raising your hand, if it's related to the content, please put it in the Q&A. Or if you just are, again, a general comment or question, put that in the chat and we'll take care of it from there. Thank you.
Okay, perfect. Thank you so much. So yes, as Dr. Granado said, my name is Dr. Chansey. I'm from the Centers for Disease Control and Prevention in the Division of Parasitic Diseases and Malaria, and I'm happy to be here today discussing New World Screwworm, specifically what community health workers need to know. I have no financial relationships to disclose, so here is my statement of that. And then today, as she said, we're breaking this into 2 sessions. And so today our hope is that we can explain to you what New World Screwworm is and why it's a threat to our communities, and a lot of the background of New World Screwworm, specifically the life cycle and how it spreads, and then the current outbreak that is happening and what it means for us in the US. So before we start, I'd like to know, how much have you heard about New World Screwworm? And your answer choices are a lot, some, a little, or nothing at all. Great. And it looks like we have representation from all the different categories, with the most number of people having heard some materials about New World Screwworm. But some people are new to this, having heard nothing at all. And thankfully, some people have heard a lot. So let's get started. So why should community health workers care about New World Screwworm? Why do you need to know about it? There is an ongoing outbreak of New World Screwworm in Mexico and in Central America that poses a threat to communities, especially those U.S. communities along the southern U.S.-Mexico border. New World Screwworm threatens animals, economies, and our food systems, and many different domestic and wild animals can be affected, including cattle, horses, and dogs. And of course, New World Screwwormiasis can also cause significant illness and contribute to death in humans, which is why we're talking about it today. So what is screwworm? Screwworm is something that causes myiasis, and myiasis is a general term that's used to describe an infestation with fly maggots. So there are many different types of flies that have the maggots that you can see here in the picture, and these maggots cause a clinical condition called myiasis. New World screwworm is a particular species of fly called Cochleomya hominivorax that causes a particular clinical condition of myiasis, where the maggots from this fly feed on the living flesh of any warm-blooded animal, including humans. Oftentimes, we see that these maggots feed on livestock, like cows, but they can also infest humans, wildlife, or even pets, like dogs or cats. Now, the name hominivorax tells us what it does. It means human eater, and that name came from a point in time in 1858 when people who were observing that there were a lot of larvae associated with the deaths of hundreds of prisoners on an island. And so they named the fly associated with this larva Cochleomya hominivorax. This is a picture of the New World screwworm fly. The adult flies are about the size of a common house fly or slightly larger. And you can see that the fly has orange eyes, a metallic blue or green body, and 3 darker longitudinal stripes down the back. And we'll show some more pictures of the fly in just a few minutes. These flies lay eggs, as all flies do, and the female flies lay their eggs directly on wounds or directly on ears, eyes, nose, or mouth of whatever warm-blooded animal they happen to come in contact with. When they lay the eggs, hundreds of eggs are deposited within a very rapid time frame. So you can get up to 300 or 400 eggs deposited just within a few minutes of the fly encountering the person or the animal or the dog. And when these eggs are laid, they turn into maggots when they hatch. And these eggs turn into maggots within about a day and cause severe tissue damage, which can be fatal. This is a picture of the New World screwworm life cycle. You can see that we start at number 1, where the female adult flies are laying the eggs on a wound. Once the eggs are laid on the wound, as I said, within about a day, the larvae hatch. And they don't stay just on the surface of the wound. They burrow deep, deep, deep down into the wound and feed on all of the living flesh for up to 7 days. After 7 days of feeding, the larva then can fall out of the wound into the ground, and they continue the life cycle as a pupae. And once they've been in the ground for a period of time, then the pupae, adult flies emerge from the pupae to continue the life cycle. This is a picture on the left of a wound with all of the life stages represented. So you can see the egg patches are in white, and then there's several female flies here, and then there's multiple larvae coming in and out of the wound. On the right is a picture of the larva. This is from USDA, but typically the larvae are found in the ground. So the New World screwworm fly can look a lot like some other common flies that we see around our house or around the environment. As I mentioned, the New World screwworm fly has red eyes and a metallic green or blue body with a shorter stripe down the center and kind of a yellowish orange face. So now I'm going to show you 3 different flies, and I'd like to know if you can figure out which one is the New World screwworm fly. Okay, great. So the majority of people chose the correct answer, A, but you can see in the pictures, these 3 flies look very similar to each other. And so we would not expect someone out in the environment who might see a fly pass by them to be able to quickly identify which one is New World screwworm or not. This is the New World screwworm fly. Again, it's in the blowfly family, and it has blue or blue-green coloring with 3 darker, nearly black patches that run down the back. The other 2 flies that we showed, this one is called the flesh fly. It's gray or black with some bristles on it, and it's very common and widespread, and you often see it associated with the decaying flesh of dead animals. This other fly is also in the blowfly family, just like New World screwworm. It's called the green bottle fly, but it does not have the 3 stripes that New World screwworm does. This fly is also very common, and you can see it all around, and it's often associated with rotting materials like food trash. Okay, so let's look at a time in the past when New World screwworm was present in the United States. New World screwworm was here in the United States before 1966. And because it caused such economic destruction at that time, the United States Department of Agriculture developed a way to eliminate the New World screwworm fly. Through scientific methods and advancements, they determined that if you sterilize the flies and allow the male flies that are sterilized to mate with female wild type flies, then when they lay the eggs, they're unfertilized and the larvae never hatch. This is important, and they were able to determine this because the female flies only mate once, but the male flies can mate multiple times. And so by sterilizing the males and mating them with the wild type females, those wild type females once they've mated once, and once they've made these unfertilized eggs, the larvae never hatch, and then the life cycle does not continue. So the outbreaks in the 1960s were managed using the sterile insect technique, as well as intense monitoring with isolation of any infested animal and treatment of any infested animal. Once USDA was able to eradicate New World screwworm from the US using this technique in 1966, they then focused on the rest of Mexico and the rest of Central America, and they were able to push the fly down all the way to South America. It took them 40 years to do this effort to push the fly out of the US, out of Mexico, and out of Central America. And finally, they eradicated it from Panama in 2006. They established a consortium. It's called the Panama United States Commission for the Eradication and Prevention of Screwworm. And this organization produces sterile flies in Panama. This is the only place in the world that produces sterile New World screwworm flies. And this control program kept New World screwworm below the Darien Gap between Panama and Colombia by continuously releasing sterile flies in that area and creating a barrier. We did have one outbreak of New World screwworm recently in the United States in key deer in Florida. The local outbreak occurred over the course of several months. USDA immediately responded by releasing these sterile flies and providing medications to at-risk deer. And through these efforts, New World screwworm was successfully re-eradicated in 2017. Unfortunately, the source of the outbreak was never identified. There was also a previous outbreak in 1976 in Texas as the fly was being pushed down through Mexico. You know, once it was present in Mexico, some flies continued to come back into Texas. And during that 1976 outbreak, the number of cattle and goats and sheep that were infested were quite large and again caused a lot of economic destruction. USDA has done some analysis and determined that if New World screwworm were to come back into Texas now in present day, that the economic cost to the Texas economy could be a loss of $1.8 billion if an outbreak was the size that occurred in 1976. So now let's talk about the current outbreak in Central America and why we're concerned about it as it's continuing to move closer to the United States. This is a timeline of the New World screwworm outbreak that has been occurring in Central America and Mexico. As I said, in 2006, New World screwworm was only found in South America. But around the time of 2022, 2023, it breached the Darien Gap and was starting to occur in Panama and finally then in Costa Rica. Since 2024, it has moved northward from Costa Rica all the way to Mexico. You can see that animal cases have occurred in these countries first, and then subsequently, after a period of time, we have seen human cases occurring in these countries as well, with the majority of new human cases occurring just this year in 2025. This is a map of New World screwworm cases in the region that's published on the USDA website. This map is from August 23rd, 2025, so it's about a month old. But you can see that I wanted to illustrate the first black line down here at the very lower right-hand corner of the map is the Darien Gap, and that's the first barrier that I was mentioning where New World screwworm was held only in South America and then eventually jumped that gap into Panama. And then as it moved northward, you can see this second black line in the middle of the map at the Isthmus of Tehuantepec. USDA was hopeful that they could hold New World screwworm back beyond that line through the sterile fly release. But unfortunately, the fly has now moved northward beyond the Isthmus of Tehuantepec into some of the northern Mexican states. So we are tracking the cases in the region, and to date, we know that there's over 770 human cases in the region, including 6 deaths. All of the countries have reported human cases, and as of last week, there were 49 human cases reported in Mexico since the reporting began in April of this year. We anticipate that underreporting is likely, but we currently know that there's over 116,000 animal cases in the region, which includes livestock, wildlife, and companion animals. If you haven't seen on the news yet today, yesterday, the USDA published a press release on their website that showed that Mexico confirmed a case of New World screwworm in Nuevo León, which is less than 70 miles from the US-Mexico border. On their press release, they mentioned that this was a cow that was transported from a known infested state in the southern area of Mexico and brought up to Nuevo León. So it's not a locally acquired case. And that's an important distinction because we want to make sure that that cow in that area is appropriately treated and there's surveillance ongoing in that area. But right now it's considered an imported case. So USDA is working hard in the region with their local counterparts in each of the countries. Control efforts are continuing. They're releasing sterile flies. They're only releasing them at the northernmost edge of the outbreak. There's not enough flies presently to release across the entire region. They're making sure that animal movement controls are ongoing. Like I said, this cow had been moved. So they want to make sure that there's checkpoints for livestock transport, that there's inspection of animals at slaughter and other sites. They're working hard with partners in the region to make sure that there's increasing surveillance through farm visits and through reporting of animal and human cases. And then there's ongoing health education initiatives for communities and livestock producers, for human healthcare providers and migrant health workers, and for veterinarians, animal health workers, and wildlife management officials. USDA is also preparing for a potential domestic incursion of the fly. So they have increased monitoring at the Texas-Mexico border. They are placing fly traps around the region, and they are also sending out specialized USDA mounted patrol officers called tick riders to look for any infested animals or wildlife. There's also border crossing inspections. And if New World screwworm does reach the United States, the strategy that USDA has for eradication is again to use the sterile fly technique and to develop and enforce animal movement controls, as well as encourage increasing passive and active surveillance, outreach, and education in the impacted areas. Prompt reporting of any New World screwworm case is critical for the response. We want to encourage you to report both human and animal infestations so that USDA can start monitoring for the flies and using these control measures in the correct areas to prevent new infestations. And CDC and USDA are working together with other government agencies as well to encourage and support reporting by everyone, especially healthcare providers, veterinarians, and public health officials. On the press release that came out yesterday that I mentioned just a minute ago, USDA had these recommendations for New World screwworm detection, and they specifically said that they urge residents on the southern border to check their pets and their livestock for signs of New World screwworm, to look for the maggots and the eggs, and if you suspect your animal is infested, to call the state animal health official or the USDA area veterinarian. And they also mentioned that while not common in people, if you notice a suspicious lesion on a person, please seek medical attention. So you are part of the key to helping us identify New World screwworm and helping to keep New World screwworm out of the United States. Early detection and reporting means faster response time and fewer infested animals. This helps to save lives and keep costs down. If you hear of anything or see of anything that you think could be New World screwworm in an animal, please report it right away to your local veterinarian, the state animal health official, or a USDA veterinarian. And these are some links and contacts for those people. Early detection and reporting means faster response time and fewer infested people as well. If you hear of anything or see of anything that you think could be New World screwworm in a person, please report it right away to your local or state public health department and encourage a person with suspected New World screwworm to seek medical care immediately. As I mentioned, there are other types of myiasis that can occur, and right now we want you to share all of those different myiasis with your state public health department. So let's talk about screwworm. How do we share this information? You are the most trusted messengers in your communities. Here's how to talk about screwworms in a clear and helpful way. Some potential talking points. We want you to have a positive way to communicate. You can say that we're working together to keep our communities healthy and safe from a new fly. You can say that there's an easy way to help. Just be on the lookout for any strange wounds on people or animals. Are there any other ways that you can think of that might be a positive way to communicate this information to your communities? You can put the ideas in the chat. So what would you do in this scenario? If a community member, let's call her Maria, tells you about a strange wound on her dog that has a foul smell and she sees a lot of maggots in it, what would you say to her and what would you do? So we'll come back to these comments in just a minute, but to recap what we've talked about so far, the damage caused by New World screwworm maggots can be very severe and even kill, and it can infest livestock, wildlife, pets, or people. You can see here a picture of some of the wildlife and pets infested with New World screwworm. Once the fly is introduced and established in the area, it can be difficult and expensive to control and eradicate again. Currently, New World screwworm is spreading north from Central America into southern Mexico. And as I mentioned, there's a case now 70 miles from the US border that was imported. The key to keeping New World screwworm out of the United States is staying aware and knowing what to do about a suspected maggot infestation in an animal or human. And this is a picture, we'll talk more next week about a traveler who returned to Canada with an infestation of New World screwworm. So next week, I hope you'll all come back. We will talk more about human and animal infestations and how to report cases. We do have some materials online that you can access, both in Spanish and in English. There are websites for the public, as well as website materials for healthcare providers and laboratorians. And USDA has a lot of materials as well on their website. And, oops. And this is how you can get in contact with us at the CDC through the New World Screwworm at cdc.gov email address. Or if you're a healthcare provider and have questions about a patient, you can reach out to us at parasites@cdc.gov or the 404-718-4745 phone number. All right, Paula, I will turn it back to you for questions and discussions.
All right, great. Thank you so much, Dr. Chansey. If you could pull back up your slide, let's go back to that first slide before we talk about the dog.
Okay.
We get some good responses in our chat. We're going to kind of talk about them just a little bit. And also just remind everybody, if you have a question about the topic, go ahead and put that in the Q&A button down at the bottom.
Is this the slide you were referring to?
Yeah, so let's talk about this just a little bit more. So as messengers in your community is either a community health worker or a public health professional, there's definitely going to be some ways that we can communicate about this. And as we said, we have a few talking points here, but I'm wondering if anybody has any ideas, and if you could put it in the chat and make it towards everyone, if you can do that. I think you can. You just click on everyone. Put if there's other ideas about how you would talk about this in your community, because as people start to hear this on the news, they might become a little bit scared. So I'm going to see if I have anybody in here that's put anything in here yet. Don't be shy. I like what we have here. Like, we're working together to keep our communities healthy and safe. Just be on the lookout. Wonder if you have any other ideas about what people could say. Community centers can post flyers. That's great. Perhaps focus the discussion on animals like pets, livestock to start the discussion. Great. Like, start a conversation on the topic. And if you were to start a conversation on the topic, we have we've given a few places where you could start for resources, community centers, group discussion through radio stations. Have a flip book with the information to educate community. That's great. Work with our local 4-H or FFA groups as well. Hand out information. I'm just reading these, Rebecca, as we go through, and then we can talk a little bit more about some of these ideas. Community surveillance and reporting of impacted animals. That's kind of what we're talking about today. Definitely want to report any animals that you think may have been impacted. Posting information flyers in veterinarians' offices. Pet stores, great suggestion about posting information flyers there. Or pet stores can educate their employees and customers in case, especially at some of the pet stores that have veterinarian offices as well. Bilingual information posters or flyers. I think that's also a really great idea. Diagnostic guidance for veterinarians through the local veterinary medical associations. Absolutely. Also, I have keep your pet areas clean, pick up after pets and timely. Maybe target people that are unhoused that have pets. It's a great suggestion. Have a collaborative meeting, including our local extension services, veterinarians, medical providers, doctors, nurses, LHDs. Notices for pet groomers. That's actually a really great idea. Maybe I'm going to stop there for a moment. Dr. Chansey, if there are any of these ideas that have either already been implemented, or did you hear some suggestions that sounded like kind of piqued your interest in terms of next steps, maybe?
Yeah, so I'll just mention that if you go to the USDA website that I linked on here, they do have a lot of materials for veterinarians and for pet owners. The CDC deals with the human cases and USDA deals with the animal cases, but we're working collaboratively together to make sure that our communication is, joined and combined. But we do plan to have an AVMA webinar sometime, hopefully next month. We're working on that now. So we are working together with USDA to try to reach out to a lot of these key stakeholder groups within the pet and animal community. But I think the comment about the groomers is an interesting one. I'm not sure that that has come up yet, so I'll definitely mark that down to share with USDA.
Thanks. And again, keep the comments coming because we'll also save the chat and we'll have a lot of these ideas. Your on the ground community ideas are really vital to help, again, like to stop this from getting into our communities and creating a lot of damage. I do know that next week we're going to be talking a lot about sort of the nuts and bolts of the disease. So if you have any questions right now, feel free to, again, put them in the chat and just know that some of the clinical information we're going to share next week. Right now, we're talking a lot about the transmission, talking a lot about how it got into the US in the past and how it's looking currently. I've got a couple of others. Community sound bites on TV, like short infomercials. I think that's great. Developing an ongoing training for community health workers, explaining the animal and human health. That is a fantastic idea. I feel like this was the first step towards that. So we're already in the process of at least having this recording available and also these slides available, which will be great. Working
I
with,
think,
go ahead.
go ahead. I
No,
was
go
going to
ahead.
say, I think your earlier question about, if people hear about it on the news, how to talk to them about it, because I feel like with this news report yesterday from USDA, I've already looked, Googled, and there's several news articles that are coming out about it. So I feel like it may be a topic that comes up in the Southern Texas communities. So I'm curious, if people in your communities hear about it or are talking about it, what information can you take back to them from this presentation or from other things?
That's a great talking point. Again, back to the talking points. Maybe Luke can say, what if the news media comes out and somebody sees it and they talk to you about it? What would you tell them right now? And I think we've heard a couple of great suggestions. I think we're actually still getting some great ideas in the chat about communication wise. Animal rescues, pet adoption agencies, um, partner with the humane societies. That's great. Information getting out to feed stores like the Southern State or Tractor Supply. Traveler guidelines to the outbreak areas. Maybe, Dr. Chancey, you
So
want to
we
talk a little bit about
actually,
that? Yeah.
yes, we actually do have travel guidelines on if you go to each country in Central America and if you go to each country in South America and the Caribbean, where it's either endemic or whether there's an outbreak, you can find information about New World Screwworm posted in an alert box for the outbreak countries and posted under the, you know, what to watch out for diseases in the endemic countries. And I can make sure those slides are present in next week's slide deck so that we can share those as well. But yes, we did have a travel associated case last month. I'm not sure if people heard about that. That person had traveled to El Salvador and came back to the US. And so we do want to alert anyone who's traveling to these outbreak associated countries to be aware that New World Screwworm is present.
Great. I'm going to keep reading a couple more of the comments. Utilizing Good Health TV to add to community awareness by posting info there. Also, Instagram and Facebook, chat rooms, links and apps for Screwworm case map hotspots. That's an interesting suggestion that's probably already in the works, but definitely social media. Unhoused communities need to be notified of better wound care practices.
And how can that happen? I mean,
Yeah,
how can the states and the local jurisdictions help with that?
and maybe if we have any of our public health, state health or regional health experts on, you can put some suggestions on in that. It's definitely a difficult to reach population, so any ideas that you have. Also have a suggestion about the dog scenario. Advise the dog owner of the current situation and the importance of prompt intervention. Tell them to seek immediate veterinary attention. If I were the attending veterinarian, I would debride the wound, collect the larva, and contact the USDA and or the Texas Animal Health Commission and submit the larva. Is that the correct response, Dr. Chancey?
Yes, definitely reach out to your state public health veterinarian. Let me see if I have that slide again. It's up further north. Yes, if you contact any of those people, they should know how to report it appropriately. But this is the reporting contact for animals, the state animal health official or the USDA APHIS veterinary services. And again, in Texas, you may have a local contact that you go to first before you go to the USDA. And then for humans, we want you to contact your local or state public health department at Be On Call.
Great. And there's a question, has there been a joint CDC USDA statement made yet?
About
New
what?
World Screwworm, like a joint, I don't know, that was just the question, if there's been a joint statement made together with CDC and USDA combined.
So CDC, USDA, and multiple other government agencies are working very closely together on this New World Screwworm issue, and we've made multiple communication documents together. You can see in the press release, if you click on it for the USDA press release from yesterday, that they mention all of the government agencies and how each one is involved. So CDC is mentioned on that USDA press release. We did issue a joint press release together last month when the travel associated case was identified in the US. So we are working very, very closely with all of our communication efforts with USDA.
Great, thank you. A couple other suggestions is billboards. I'm working my way backwards here and now forwards again. Um, just kind of talking a little bit here too about how there's some underserved populations and communities that sometimes accumulate trash or garbage that could attract rodents or flies around their communities. Wondering if there's just somebody suggesting the thought of bringing in government or supporting community officials to help them clean up as a preventative measure. Can you talk a little bit more if you know anything about sort of prevention when it comes to are these flies the same as other flies where they're just attracted to places like this where you might have a lot of rodents or flies or trash, or is this a different type of risk?
Yeah, let's go back to those flies real quick. That's a good question to clarify.
Hmm.
So of the three flies that I showed you, there's a lot of flies, obviously, that you might see around. The difference between fly B and fly C compared to the New World screwworm flies is these flies cause what's called facultative myiasis. And this particular one that I'm showing right now, the green bottle fly, is associated with rotting material like food trash. So it doesn't, in order to nourish itself, it doesn't have to consume living flesh. It can consume food trash. This one, the flesh fly, instead of consuming living flesh for its protein and its nourishment, it can consume decaying flesh of dead animals. So if you think about dirty areas with a bunch of trash, you might see something like this fly. If you think about roadkill, you might see something like this fly. The reason that these two flies are very different from New World screwworm, the New World screwworm fly only eats living flesh, the female. The males can eat nectar from flowers and things that are not living flesh. But you won't see a New World screwworm fly on dead roadkill, and you won't see a New World screwworm fly on trash. They only eat living flesh, which is why it's so dangerous and so different compared to some of these other more common flies that you think of with a hygiene issue. The hygiene issue with New World screwworm is an open wound. It's attracted to the smell of an open wound, and it's attracted to, eating the living tissue and the living flesh of that open wound.
Great, thank you. And so I think what I understand is that if you have, again, an area where there's a lot of potential for, like, let's just you say like common flies, it's not necessarily a place that would be attracted to the New World screwworm fly.
So, I mean, one of the concerns, like I said, is wounds. And if I agree with the person who commented that unhoused people may have wounds that then may attract the New World screwworm fly. And unfortunately, once the New World screwworm fly is present and the larvae are causing the destruction, that could actually attract other flies as well. So you can get multiple flies in the same infestation. It can have a compound problem. But yes, typically, if you think of just a trash pile, you wouldn't necessarily think of New World screwworm. You might think of some of these other flies.
Great, thank you. Have another comment, says lots of cattle and livestock are in this person's region. And she wanted to get New World Screwworm info out to the local farmers, livestock managers, partnering with the local environmental health counterparts as well to provide resources and guidance would be best. That's a great suggestion. I know we do talk a lot between the Health and Human Services and Environmental Health and the USDA. So I think that it sounds to me, and maybe you can correct me if I'm wrong, that USDA has been doing quite a bit of outreach to sort of the ag industry. And so this is now our efforts to talk about the medical professions and the health community as well to be on the lookout. Is that correct?
Yes, that's correct. And like I said, we're collaborating with USDA on all of these efforts. But we are also planning outreach to some of the livestock industry from an occupational health standpoint. We're trying to reach out to the ag workers and to others who might be at risk from being around livestock who might have flies. But yes, typically USDA has been reaching out to the ag industry from a livestock cattle perspective, and we are trying to reach out from a human health perspective.
Thank you. We've also got some comments and questions being answered in the Q&A, so I encourage you to take a look at those. You should be able to see those live as they're happening. We've got Mark and Sue are actively answering those right now. I have somebody that said, Lachey said, we would tell them that if they are concerned about a wound, they have to seek professional help and take special note if the wound is painful or not. That's sort of a response to like talking points of what we would tell them. Also for community members to be vigilant, protect themselves, and visit immediately a veterinarian for follow-up if you see a suspicious wound on your animal or as a human. I like also give them the contact information or the links that the Department of Public Health and contact to assist with best practices. These are all really great talking points. A suggestion for information at public libraries like bulletin boards or info sessions by extension services. So I know in Texas, we work a lot with our ag extension offices in the rural areas. How much, Dr. Chancey, do you know about ag extension offices? I'm assuming they usually work with their 4-H groups and with the USDA. Has CDC been reaching out to those groups as well? Do you
So
know?
we're partnering with our states, and so we're partnering with Texas DSHS, and Texas DSHS is partnering with, Texas has an entire commission for New World Screwworm, and so they are partnering with the ag extensions within the state.
Great. That's great. I've worked with a lot of great extension offices there too on Chagas disease, so I know they're a really great resource. They're very well connected with the community. Um, Reach out to your homeless alliances and other nonprofits who work with the unhoused persons. Also churches who work with unhoused persons too. That's great suggestions. Um, I like that somebody said also continue brainstorming like this today's to help utilize those partnerships to add to your resources. So again, like we're recording the chat here, so capturing all of your great ideas and they are getting to the right people right now. So thank you for keeping the ideas coming. My gosh, they're coming fast too. So this is great. Um,
I think one of my questions, we'll talk about human health next week a lot more, but how do we encourage people who might have a suspicious wound to seek medical care? Because I know sometimes, if you're in a rural area, there may be more challenges to seeking medical care, but it's really important both for the person's health and then also, to make sure that we identify where the flies are located, for this person to get care as quickly as possible.
yeah. Was that a question, Rebecca? Or was that just
Yeah, it was a question, a talking point. How, is there anything that the community health workers can do to encourage people to seek care if they notice something?
And then we have a comment about unhoused population seeking medical care can be really difficult. Absolutely. But I know there are, resources, and I think that that's an important thing is tapping into some of those community-based resources, especially that you all as community health workers and others, public health groups know who they are. It would be really good to just translate this information for them to them that, hey, you've been hearing about this and keep an eye out for that and finding support. What I guess this because this is sort of a emerging outbreak threat. Do you know if there's resources available for people that don't have access to healthcare to help address this? Would there be some resources made available? I don't mean to put you on the spot with that question because you may not have an answer, but I know in an outbreak situation, sometimes resources can be a little bit different.
Do you mean medical care?
Yeah, like medical care. If there was a suspected case and somebody didn't have insurance, for example, um, will
I
the
mean,
state?
my understanding is, anyone can show up in the ER, and so we would, if that is where that person needs to seek care, in order to get the larva removed and the wound addressed, then someone needs to help them get there.
Okay. Visit your local FQHC health centers, FQHCs. That's, yeah. Thank you, Belinda. That's right. So if somebody is struggling with healthcare, our local federally qualified health centers, and there are some free clinics or low-cost clinics that would be available just to help support that. So, I think providing this information for our FQHCs is definitely a great idea. Let community members know that this could be life-threatening and could spread to other family members. Is that an appropriate talking point, do you think?
So we'll talk more about this next week, but this is not, we've heard a lot about a lot of different diseases. I know Texas was just dealing with the measles outbreak and such. This particular outbreak and this particular infestation doesn't spread from person to person. It spreads from fly to person. And so that's what's unique about it. And that's why we want to know where the flies are, because wherever the flies are, that's where new infestations can happen. And so there's no concern about other family members in the house getting it from an infested person, but there is a concern if the fly is present that the fly may infest other family members. So that's why we're trying to identify quickly, report quickly, get, USDA's response out there quickly to manage the fly. But a internal, human to human within the house situation doesn't happen similar to other diseases.
Great. There's also someone had mentioned, and this is in the chat, so I apologize if it's also in the Q&A, but the mention that the screwworm larvae will drop off to the ground. Is there anything that can happen if livestock ingests the larva?
That's a good question. I'm actually going to let Mark answer that question.
Okay. Mark, if you want to put it in the chat, you can, or you can just pop in and answer.
Okay, I apologize. I was typing in the Q&A and so I missed the conversation. What am I answering?
Yeah, there was a question in the chat about if the screwworm larva will drop off to the ground. Is there anything that can happen if livestock ingest the larva?
No, and that question did end up in the Q&A as well. The only way that the infestation occurs is by egg laying on a wound or a mucous membrane by the adult fly. So there's no transference of a maggot from one infested animal to an uninfested animal, and consuming them wouldn't be harmful. So yeah, so thankfully that's not a major concern.
That's good. That's great. I had a couple people also post about state fairs that have been happening as a great place to share information. So we're definitely like documenting that is a good idea that we can pass along. Someone also mentioned about the zoo, about informing zoos. I think it says LA Zoo, but I don't know if they mean Los Angeles or Louisiana. But either way, zoos would be a really good place to also provide information to. I know I'm in San Diego. We have our amazing San Diego Zoo, but there may be also other smaller zoos in some of the more smaller areas that might need this information.
Yeah, that's a good point. Again, we're trying to raise awareness from a human health standpoint there is no New World Screwworm in the US at the moment, but we're trying to help people along the border recognize when there may be an infestation that occurs, especially now that there's been a case that's 70 miles south of the border. Once it's in the US, whenever that may happen at some point in the future, then obviously we want to make sure that the broader community is also aware of it. So some of the zoos are a great place. I don't think that's where the first case will happen, but we definitely want to make sure that people are aware of it from an animal protection standpoint.
Great. And that's a really great reminder that it's not detected here in the US. We've only had travel-related case or two, or I don't remember how many you said, but we'll talk more about that next week. I think somebody also asked if there has yet been any communication out to the hospital systems in the US and the border states yet. Do you know?
So that's a good question. Again, we're in close communication to all of the health departments within the border states, so Texas, Arizona, New Mexico, California, and they are doing their own efforts at communication within their state. But we will release a health alert notice, which will go out to all the physicians and healthcare providers who receive that listserv. Once there is evidence of local transmission in a northern state in Mexico that's bordering the US. So right now that has not yet happened. There's only that one imported case. And so we have not yet released the health alert notice, the HAN.
Great, thank you. Somebody else suggested a designated 800 phone number for just the New World Screwworm information guidance for the public. Is there already one, or is there talk of having one?
We haven't discussed that yet, but we can definitely take that suggestion back to the team.
Great. These are all really good comments. Again, sharing ideas, this is the place to do it. I mean, you all are in the community working, understand how to communicate with people on the ground. So this is really good. And I know we've been talking about this sort of from an animal infestation point of view. And again, next week, we're going to talk about what does it look like in animals and what does it look like in humans to help better understand it so we can recognize it and identify it better. So these are all really good suggestions about communication, which is the first part of this conversation. And we're going to talk more about that again next week. Just trying to read a few more of the questions. There's so many great questions coming in. So a lot of state animal health officials definitely doing large amounts of outreach to the stakeholders. It's definitely not just limited to like extension services, zoos, livestock shows, etc., but lots and lots of outreach is happening. So I think if we're thinking about human healthcare providers, that's really where we're focused on for these sessions. Again, it's important to talk about animals because they're really that sentinel that, people might find them in their pets or their livestock first, and then we have to really be careful about finding the cases in animals. And I don't know if Dr. Chansey, if you want to talk maybe just a little bit more as a preview for next week of what's the difference sort of between our concern between animal outbreak versus human outbreak. I don't know if you can describe that just a little bit more, maybe.
Sure. And I'll just say this is one of those unique diseases that truly is a One Health disease. So we see it in wildlife. There's sloths in Costa Rica that are dying of New World Screwworm. We see it in, animals like livestock. We're seeing it in companion animals like dogs. But then we're also seeing it in humans. And so it's truly a One Health issue, and what is impacting our animals is impacting us, and what's impacting us is impacting our animals. I would say, Mark, I think you said when we looked at the 1976 Texas outbreak, there were 70,000 animals infested and 10 humans infested in 1976. Is that right?
Yes, that's what I found.
And so
And
that's
yeah.
about the ratio that we're seeing roughly in a lot of the Central America countries as well. Obviously, the Central American countries, some of the human infestations that we're seeing are a result of poor hygiene conditions, which we, may impact some of the unhoused community, but wouldn't necessarily impact others in the US. So I think each different community in the US might have different risk factors. So the ag workers would have a potentially different risk factor than the unhoused community, than the, city dwelling communities. So that's something to keep in mind. Mark, did you have something else to add?
No, no, I think that covers it.
Great. I'm just sort of going through the Q&A and well, I just saw a question that I thought might be good to have a little bit more of a discussion. Let's just see. I'm going to find it here in a second. Sorry, I saw it and then I got distracted by all the great questions.
Yeah, I will say while you're looking that, across the human spectrum, we've seen infestations in babies and neonates all the way up to elderly. So from an age standpoint, there may be more of a predisposition to like I said, the farm workers in the 50s and 60s, 40s, 50s, 60s age range, but children can get infested, older adults can get infested, anyone of any age can get infested.
Great. I think I did see a comments about um like as a communication tool posting graphic images or not. The question was yay or nay. What do you think about the impact of some of these graphic images in terms of reporting? I know we've used, this is a different type of graphic image. I was thinking back to Zika whenever we had the babies that were born, unfortunately, with deformities and things like that. There was a lot of information shared that really kind of got people engaged. I don't know, just what are your thoughts from a communication standpoint of using some of the graphic images for our communications? Do you think it's helpful or not helpful?
Well, I agree with you. That's a question that we're trying to balance as well. Next week during the presentation on humans and animals, there will be potentially more graphic presentations, more images. I have elected to not include some of the extremely graphic images that we have access to. I It goes back to me to the question of, will a person seek care? As a pediatrician, as a medical care provider, I want a patient to seek care. And my concern is that there's a lot of people who will ignore something until it's really serious. And so I don't want to scare people inappropriately, but I want people to be aware and informed of how dangerous and severe it potentially could be if it was left unchecked and untreated. And so I think this is where messaging and having advocates in the community and having people who are aware of the level of, um, the degree of severity that it could get to, being available to talk and encourage these people to seek care right away so that it doesn't get that bad.
Great, thank you. And somebody else also mentioned too the, and I think this is really a good point, is chronic substance abusers or IV drug users also are at a higher risk. They may or may not be unhoused, but definitely having open wounds or skin issues could put them at a higher risk, and they may also not have access to health care. So just kind of bringing that up, I think we'll talk more again about how the infection impacts people. And, but I think that's a really good point about substance users being at a higher risk. Several people have said that they do think the graphic images would have an impact, and I agree with what you said, Dr. Chansey, about balancing it with what's appropriate and what's not appropriate, obviously. But as a graphic warning, and I mean, good wound care is always a good idea. So if there just needs to be extra precautions made, and again, next week we'll spend a little bit more time talking about that.
One thing that we
Mhm.
will talk about next week as well, we're focusing on the wounds because that's the most common place for the flies to land, but the flies are attracted to mucous membranes. So your eyes, your mouth, your ears, even the rectum and vagina can be involved if it's accessible to the fly. So you can't cover your eyes, obviously, but there are pictures graphic pictures of infestations in the eye, similar to the dog that I showed.
Something else also, and you may have said it in the beginning, but maybe redefining it. We've used the word myiasis a couple of times. This was a new term for me, and I'm wondering if you want to just describe that one more time in case anybody missed it.
Sure. So myiasis is a general term which encompasses New World Screwworm myiasis and all sorts of other myiasis. Mark mentioned facultative myiasis in his comment here. But myiasis is when the fly lays eggs and those eggs become larvae, and those larvae are in a human. So whether it's through the New World Screwworm fly depositing eggs or one of these other flies depositing eggs, those eggs become larvae, and those larvae are in a human, and that's called myiasis. It's the clinical condition where a human is infested with some kind of fly larva.
Great. Thank you. I think it's a term that not a lot of people may have heard, including me. So
Mhm.
it's great to always keep defining that. I have seen it a lot more now that I know what it is. I actually have seen the word a lot more frequently. Okay, let me just see if there's any more Q&A coming in. Again, I encourage you all to take a look at the Q&A while we're here. I like this comment about infographics making simple and easy vocabulary, definitely bilingual, especially for older patients or older people who also may need visual aids or maybe their literacy levels are low. I think that's a really great idea. And again, this just as a reminder in general, this is being recorded, and we will have this session posted on our website. And there's a link. Maybe we can put another link in the chat one more time for that. And um, there's also, we're going to have a list, I think like a PDF with clickable links for all the different links that have been shared in the PowerPoint. So just be aware that we'll have all of that available. So if you didn't catch it right now, and you want like a link that you can click on and share, that would be great. And again, I think somebody else had also said, like, taking a picture, if you see like a poster or a flyer out and about and you want to take a picture of it and share it on your social media with your social networks, that's a good idea. That's the best way if you're having well, that's one really good way to share information that you know is accurate because it's coming from a good source and to help kind of share that information with your community members. Other questions or thoughts? So there's a lot of information. We still have about 15 minutes. I'm gonna go ahead and put up the evaluation QR code again, if you don't mind. We do have an evaluation. Again, if you would like to get credits, and you need a certificate for this, we really encourage you to fill out the evaluation. But we also request that you fill out the evaluation anyway, just because it's good for us to know that how you felt about this session. Let's see. All right. Any other questions or comments? While you're thinking, a reminder, next week, same time, the same link, which will also send out a reminder. And again, thank you all for the change in the link. We had a lot more interest than we had anticipated, and our original Zoom could only host up to 300 people, and we had quite a few more people registered than that, so we needed to switch. We will send out another reminder with the link again to the session, but if you put it in your calendar, if you go to the link website that says updated link, I'm sorry, email that you received today, on there's a calendar link where you can put it in your calendar. I would suggest people do that if you can, so that way you don't miss next week's. Let me see if there's anything else. There's a couple of comments in the chat about different types of infestations that we've seen in other countries. Is next week's different than today's? Yes, there was a question that just came in. So next week, we are going to be talking about the clinical signs in humans and animals, and we're going to dig in quite a bit deeper. Today was sort of the upper level communication, introducing the topic. And next week, we're going to take a pretty deep dive, a lot more content than this week. So we really hope that you can come back. Go ahead, Dr. Chansey.
Oh no, I was just reading one of the questions that was being put in the chat.
Okay. So we still got some questions coming in. Okay. So I think with that, I think for today, we're pretty much done, and we really appreciate all of your fantastic ideas that have come in. All of them have been, again, recorded, and we're really grateful. If we didn't get to all of them, come back next week. We can ask more questions. Definitely put your information in the chat so we know you were here. We can also, when you had to switch over to the webinar link, you also entered your name and email, but it's good to put it here as well. That way we can make sure that we have record of your attendance. And other than that, if you all have more questions, we're going to be around for a few more minutes. Otherwise, we look forward to seeing you all next week. Feel free to drop off and come back next week, same time, same place, same link, and we will see you then. Thanks everyone for participating. This has been a great discussion. And if we could just stick around here in the main room for about 5 more minutes before we go backstage, that would be good. That way people do have other questions they can pop on and ask them. And Ed, I see that Mark is answering your question right now. Thanks for your great comments. Again, next week we're going to go into a little bit more, quite a bit more detail. The evaluation, Ed, there's a link in the chat. Maybe we could put that link in the chat again, just because we got a lot of messages going on in the chat. There we go. And then there's also the QR code on the screen. You can scan that with your phone. If you're not on your phone right now, some people are on their phone right now, and if you are, you can also click on the link in the chat. Please feel free to, please fill out the evaluation. It'd be great. Thank you again for coming. Great to see you, Mustafa. We'll see you sort of. Thanks for coming. Okay. Be here for like about 2 more minutes. Great question, Melinda, about the eval. It's the same one for each meeting. Do we need to have you do it twice or just once next week? That's a really good question. I hadn't thought about that. If you don't mind doing it twice, that would be great. That way we could get it for both times. Yes, Belinda, who's in charge of our community health worker evaluation, says, yes, please fill it out for this session and for the next session. It says it will not let me do today's. Melinda, did you happen to attend last week? That's why. Okay. Okay, so if you attended last week and you're trying to fill out the evaluation, it's probably not going to let you. So what I can do is next week, I will have a new link. It'll be the same evaluation, but with a new link. And then that way, you can complete it for both sessions. Belinda, does that work? Okay. All right, so we'll open up same exact survey, just with a different link, and it'll be covering both today's sessions and next week's session. If you happen to have attended last week, and we'll do it again with a new link so that those of you who filled out today's will also be able to fill out a new one next week as well. Great. Thank you all so much. Okay. Any other questions about logistics or next week? Feel free to put those in the chat. I'll be happy to answer them. All right. Maria says you were able to fill out both evaluations last week and this week. Well, that's good. I feel like with this many people, sometimes there's always going to be glitches. Either way, I will definitely have a new link for next week. Same eval, just a different link. All right. Any other questions? Okay, I think with that, we're gonna, as the hosts and panelists, we're gonna jump into the breakout room. But we look forward to seeing everyone who's still here with us next week. And thank you for coming today.